In psychiatry, these days the dual diagnosis is becoming very common. They have one primary diagnosis and there is a secondary diagnosis. Like in addicts, when the alcoholic dependence disorder is a primary diagnosis, while with that, when they develop other behavior disorder or psychosis, that is the secondary diagnosis. The dual diagnosis is becoming very common and it's becoming very challenging in the medical practice. When the patient come with two disorders, we have to be very cautious in making the diagnosis and treating them. We all know in addicts the personality disorders are very common. We all know if someone is depressed, he end up drinking more. And these kind of incidents lead to a complex situation where we are not sure whether we are dealing with the alcohol problem or we are dealing with the stress and depressive disorder. To make the right kind of a diagnosis, we need a proper professional setup where there are doctors, counselors, and psychiatrists who can observe. They should not be treated in professional setups where there are ex addicts or counselors guiding them and they don't know about the concept of dual diagnosis. We at Tulsi specializes in dual diagnosis treatment. We realize that 30% of the addiction population has dual diagnosis and it's a very common problem. Please help us to treat them in a right way than making them a complex disorder in problem. Dual diagnosis is becoming a more and more common problem. We know when we are depressed, we end up drinking little more, and lot of time that can lead to a complex situation where with one psychiatric problem we develop the other problem. This situation is known as dual diagnosis. Like I gave an example, the first one, if someone become an alcohol dependent, we are not sure whether we are make diagnosis of depression or it's alcohol which is leading to depression. We also know in addiction the personality disorders, the behavior disorders are very common and they need a proper professional setup for the help. In Tulsi, we provide a proper professional setup where team of the doctors and psychiatrists and counselors work together to make the right kind of a diagnosis and long-term better prognosis. They need a guidance, they need proper medication and they need long-term help. These all are the necessity for a successful treatment. Please be careful and cautious before choosing the right facility. Please take the right help and right professional ethics. Schizophrenia is affecting the 1% of the world population. That means in India we have many who are suffering with a disease like schizophrenia, commonly known as split personality, where they have the two areas. One is their own world and one is the real world. They start believing in their own world, and when it start affecting their normal life, we tell it as schizophrenia in a full blown form. Lot of time they become aggressive, they become violent, they become homicidal or suicidal. It's a complex problem where over the time it's proved to be a biochemical disorder where the dopamine and serotonin pathways are greatly affected. Because of that, they are not normally behaving. These days, the role of the medication is becoming very important, and there are modern medicines with some side effect, they are able to help them to lead a better life. When the problem is complex, the patient does not accept medication, they might need an inpatient treatment, and in complex non-treatable schizophrenics or in a chronic case where the recovery with the medication is not too good, they need a psychosocial rehabilitation where they've been given the guidance and motivated to lead a socially active normal life. In last few years in Tulsi home, we are working in psychosocial rehabilitation, and we are able to successfully rehabilitate many of our patients who are doing well outside in the society. There are few who were not even ready to accept the medication. Now they take their own medication, as well as they take the guidance and regular counseling for a better life.